Assalamu alaikum, my dear student. Today I am going to discuss with you the pharmacodynamics uses and adverse effect of benzodiazepine. Most of the effect of benzodiazepine arise from the action on the central nervous system with the CNS. The major molecular target of the benzodiazepine are inhibitory neurotransmitter receptor directly activated by the amino acid gamma aminobutyric acid. Benzodiazepine have been shown to bind with the modulate the major GABA receptor in the brain. GABA, while GABA receptor are not altered with benzodiazepine, the GABA receptor while GABA receptor are not altered by benzodiazepine, the GABA receptor is an integral membrane chloride channel that mediates most of the rapid inhibitory neurotransmitter in the CNS. Benzodiazepine, unlike barbiturates that also bind GABA, act only in the presence of GABA. Typical benzodiazepine agonists increase the amount of chloride current generated by GABA activation, potentiating the effect of GABA throughout the CNS. Biscoline, an antagonistic of GABA, reduces the behavioral and the electrophysiological effect of the benzodiazepine and a benzodiazepine analog flumazenil that potentially and selectively block the benzodiazepine binding site is used clinically to reverse the effect of high doses of benzodiazepine. These CNS depressive effect result in the anxiolytic, muscle relaxation, hypnotic, anti-great amnesia, anti-convulsant, and sedative effect that define the therapeutic usage of benzodiazepine. Although the proper dose of any one benzodiazepine will produce many of these effects, some benzodiazepine are more appropriate for certain uses than other. In the large part, this is dictated by the therapeutic half-life of the drugs. Benzodiazepine are generally classified as short 0-3 hour, intermediate 6 to 2 hour, or long-acting less than 2 hour. Some texts, however, will just use short 0 to 24 and long-acting less than 2 hour designation. Benzodiazepine used as anticonvulsant are long-acting and have rapid entry into a brain. Short to intermediate acting benzodiazepine are favored for the treatment of insomnia. Short-acting benzodiazepine are used as a pre-anesthesia agent for sedation prior to surgery. Long-acting or multi-dose short-acting benzodiazepine are generally used as anxiolytics. Anxiolytics mainly mean anxiety. What is meant by anxiety? When we are thinking about future that of something that are not happen and that are impossible to happen, the use of benzodiazepine listed in the martinidal along with their half-life of administration and normal range of dose is presented. And while GABA receptors are not altered by benzodiazepine, the GABA receptor is